This week on Physio Foundations, I'm talking again to Luke Nelson about the foundational knowledge and skills that he uses to help people with running-related injuries. Welcome back to Physio Foundations, a podcast about the knowledge and skills that provide the foundation of expert clinical practice. So if you listened to last week's episode, you had a full introduction to my guest, Luke Nelson, and we're going to go and skip the introduction. You can always go back and listen to that if you like. And in fact, you probably should, because it was a really good episode, really good chat with Luke talking about his professional pathway and what led him to his interests in helping people with running-related injuries. And then we finished off the episode talking about some of his strategies that he uses to help people with running injuries. And we're going to go straight back into a discussion about just that. So, Luke, welcome back to Physio Foundations. Thanks for coming on for part two.
Thanks, Luke. But it was hard to keep it to half an hour before. When we start getting talking on running, we get a real run on here. So let's see how we can go with keeping this one nice and short and sharp as well.
I originally was going to do longer episodes and not really run a timer, but I do realise that the feedback I've had is people like these professional development podcasts fairly short. They don't like too much of the chit chat at the start, and then having to hit the 15-second fast forward button. But at the same time, with my podcasts, I actually go for a run. I listen to podcasts when I run. I don't know do you do that as well sometimes?
I definitely do. That's where I listen to most of my podcasts. Actually, Cool. I've worked my way up to listening on 2 times speed now. So you're actually talking quite slow now, but I'm used to listening to you on 2 times speed.
Just like the students at the university listen to everything in 1.5 times speed, and when I do this, they can't understand anything I'm saying, and that's always funny.
That's right. There's a few times where if someone's got the particular interview, the guest has got a really thick accent, then I'll have to sometimes slow it right down. But by and all, I can usually get through quite a bit now. So on a 2-hour run, I can get through 4 hours of podcasts. And I need it because I've got quite a list of podcasts that I'm subscribed to. Obviously, yours is at the top, but there's a few there.
Oh, jeez. And then you finish this run and your brain's overflowing with information. It is a good way to process the information, though. You go out there away from your home environment and you're getting new ideas, and it's invigorating. It's good fun.
It is, and look, something I was chatting to someone else about recently as well, is that there's one thing, I think there's one thing to consume information, and there's the other thing to put it into practice. And I think that I've probably fallen into the trap in years ago where I just went seminar mad. I was just going to seminars and this, that, and that. And then I think I remember over a month period, I think I had a seminar every weekend, and then you get to it in the end of it, and it's just like you've just learned so much stuff, but you don't actually put it into practice. And I think that's a really good thing to, and something I'm wary of now, like after I've listened to a podcast, is just hitting pause and just sort of think, all right, well, how does that change what I'm doing? If it does, if it just simply reinforces what I'm doing is right, because otherwise you're just consuming stuff without actually putting it into action. So that's probably a tip that I've found useful over the years. Is it's one thing to consume it, but also to reflect on it as well too.
You wouldn't go to a conference without a pen and paper or a laptop. Do you take notes from the more informal professional development stuff? So podcast, you can't take notes when you're running, but in the notes page on your phone or do anything like that?
I sometimes do. I use Evernote, and so I've actually got a thing in Evernote there where I've been doing this for a few years now, where I'll create a separate note for each month. I'll say monthly items learned, and for March. And so if I'm going to listen to a particular podcast, and I'll actually sometimes will stop. Sometimes I'll just be typing whilst I'm running, and other times if it's quite intensive, I'll just stop the watch and write stuff down. But no, I'm still regularly taking notes at seminars, and Evernote. If I lost Evernote, I don't know what I'd do. I'd probably cry, because if I'm sort of thinking, what did I remember hearing about this, and then I just search on Evernote and there it is. It's there. So yes, I use that quite a bit to outsource my brain. But it's a good use there. And I also find that sometimes and you're probably the same thing. It's like a lot of people say when they're in the shower they come up with some great ideas, but for me it's out in the run. Like I'm sort of thinking like, that's what I should do, and stop down and you write it in, put it in Evernote or Trello or something like that, and so it does provide some good thinking time, doesn't it? And with running, you
should use a little microphone.
I actually haven't used that. I should
dictate
do that
into it. It takes a bit of practice, but if you just form your sentence and you say it into it, you don't have to type
Yeah, I think that's a great idea, and I know that I think it was Steve Monaghetti that I heard that said this in a talk that I saw him do once. He said, if you can't sort out your life problems in a long run, you're never going to sort them out. So it certainly does give you some long thinking time, because it is funny what non-runners will say to you. It's like, what do you do? Like, what do you think about on a 2 or a 3 hour run? And he is right. Like I've sometimes come home from runs and it's like, that's it, we're doing this. And in fact, we spoke about in our previous practice when I sold my practice was I came back from a run and I'm like, that's it, we're selling. I'm selling out. And my wife's like, oh, okay. It's so yeah, lots of things happen, and we know that there's that increase in cortical blood flow that happens in the brain. So it is conducive to thinking.
And that's something you touched on in the last episode. You were talking more about the mental health benefits of exercise, but there's also just the reorganization of all your thoughts and the way you can finish feeling refreshed. So it's a big mental boost for a lot of people. And then of course our interest is keeping people, I guess there's a bit of a false dichotomy of mental and physical going on, but dualism there, but keeping the physical side of people going so that they can have those mental health, great benefits of running. So so what about you personally? You mentioned last time your races and your experience from track running, and then going. That often happens, doesn't it? You go longer and longer as you get older.
Yeah, that's pretty much what's happening. I've got a goal to do 100. The longest I've done is a 56. But I do want to go the 100. I know you've done some long stuff, but I want to tick the sub 3 hour marathon first. So that's been I was hoping to achieve it in October last year for the Melbourne Marathon, but unfortunately I got sick 2 nights before the marathon. It wasn't COVID, but I just got a 24-hour bug that I didn't recover from, and so I trained, put in a really good training block actually, and unfortunately didn't get to race. So I've still got some unfinished business. So for the moment, I'm getting ready for Gold Coast Marathon, which will be in July. So hopefully we're ticking that elusive sub 3 box for me, and then we'll see after that where we go then.
And for those who haven't run marathons or perhaps don't live in Australia, and hello to everyone listening to this around the world. I can see on the little map that pops up on the podcast app, I can see we've got listeners in the States and in Europe and Saudi Arabia and all over the place. So hello to everyone. So for those of you overseas, the Gold Coast Marathon is a flatter track, and it's often people target that for their personal best, go out flat chat and try to get your personal best. Sub 3 hours is 4 minutes per kilometre or so, isn't it?
4:15, just under that. So
Convert that to miles, minute miles.
Minutes, miles. I always struggle with that actually. That's, I think, is it six there? But hopefully I'll be aiming for around that 2:55 to 3. So that's the goal. So hopefully we can tick that one off. It's been a long time coming, and obviously with races not happening much over COVID as well, there's been not many opportunities the last couple of years for us to get out there. So hopefully this year all goes as planned.
Yeah, it's such an important part of your professional development and your balancing your professional and personal life to think about what your own personal goals are. And it's actually really nice sometimes with health professions, and physical activity being such a big part of what we need to advocate for and do ourselves. Sometimes that's really nice when our personal hobbies and goals, cross over to those of our patients as well. Perhaps more than they would if you were doing other occupations. Yeah, so that's my segue then. That's what I want to talk about. I want to pick up on our threads. We're talking about helping people with running injuries at the end of part 1 of our chat, and you touched on a number of really nice points. Why don't we go back to just breaking it down a little bit? You spoke last time about the importance of a really detailed patient interview. So what are some of the questions that come up and that you ask people routinely? What do you want to explore when someone's coming in with a running related injury?
Yeah, so as we mentioned in our previous podcast, we're spending a bit of time talking with the runner, and I guess outside of the condition-specific questions. So, where does it hurt and what aggravates it, what relieves it, that sort of stuff. So we're always going to ask about those sort of things to try and narrow down our diagnosis there, or any contributing factors. But then, I guess for the running specific, there's probably then more questions that we want to move into there. So the first one is, as we were just speaking about, then was their goals. What are they wanting to achieve? Have they got a race coming up in 6 weeks that we've got to try and get ready for? Have they got a particular time in mind that they want to do? Do they just want to run for their mental and physical sanity? All these sort of things, figuring out why they're doing it, because that can dictate in terms of how aggressive we may be with trying to get them back on track. Like if we've got a race in 6 weeks, all right, well, we've really got to pull out all stops here to try and get you up and ready for that. Or it may be, we need to, address their expectations. They're thinking that they're going to run a 3-hour marathon and that they haven't trained for 6 weeks. Well, there might be a discussion around that, saying, look, that might be, we might need to sort of, bring that back a little bit, and obviously being, careful how you word that. But they're really important to understand what their goals and also their expectations. And one of the things that actually we'll do in our intake form is asking, what's their expectations, what do they want to achieve, what do they think is going on, and what do they think will help them. So all those 4 questions that I'll ask all our patients, regardless if they're a runner, and that will sort of allow me to sort of see where they're coming at, what for them is important, and then that'll sort of management will be built around through that. So I think those goals, that's sort of the first thing we want to talk about. Then next, we want to go into training load. So obviously with their running or whatever they're doing in a week, I want to break down of what they're doing. Now, in its simplest sense, and this is what I think that, we all know that, and we're all told, training load, it's so important, but in terms of the practicality of it, well, like how do we assess that? Like, are we just giving it lip service and saying that training load is really important, but then how are we going to extract that from the runner, what they've been doing? So I certainly will have a conversation around that in terms of what their week looks like, and get it from them first, and then we can then delve into further details by saying, well, show me your Garmin, your app through there. Let's open that up and let's see what you have been doing, whether it does allay with what you've been telling me. And looking at, obviously, the fantastic thing about wearables these days is the access to all the data that we can get from that. So flicking through their Garmin or whether that be their Strava account and looking at what that's like there. And that's in probably the getting a quick eyeball over things. And then if we really want to delve into more details, then that's where using other platforms. And I use a platform called Runalyze, and that's sort of that's free for the runner to use, and they can import all their training data into that. So that's something that I'll generally look at after the consultation, so outside of hours, once they've connected all that up. And looking through their training data there. So, and again, that's part of the education, because if you can look through and sort of say, look, okay, see how we've got these peaks and troughs here. You've done 5 runs this week, and then the following week you did 1, and then you went back up to 5, and then you went to 2, and it's just this seesawing effect through there. And just the educating them on the importance of that consistency and that progressive overload there as well, because that's one of the first things that the training load errors that we see runners do is they just do too much too soon, and that's because it's so easy to do, because you can just chuck on your runners and out you go. And the other thing as well that we tend to find in terms of training load areas is they do too hard too often. So they're often, they're thinking that every run needs to be I need to be, bending over and ready to hurl by the end of it. I need to really feel like I'm getting a workout. And so then that opens the discussion about training intensity distribution. And this is where using these platforms allow us to sort of break down that as well and see, to educate them and show them, see these coloured bars here, or see this graph, see how much time you're spending in this particular zone through here. Running hard is hard on your body. It's going to take that toll, and it's not necessarily the most efficient for building your running fitness. And so, again, aligning that with their goals. Like if their goal is I just want to run twice a week, I don't want to have to think about stuff, then maybe they can be running hard in those sessions there. But if they're like, no, I really want to get better at this, I want to achieve a certain time, and just educating them about the importance of running at different intensities. So that's sort of something, again, that we'll tend to do more outside of, and then we'll revisit that in the second consult and reviewing and educating around that to help to optimize their training. And then comes the good stuff on the shoes, the discussion on shoes. So, a lot of runners will love to spend a bit of time talking about that. But just in terms of, what are they running in at the moment? What have they run in? What do they like? What do they not like about shoes? And that sort of, again, opens a discussion about that, whether, shoe wear might form a part of their management, whether we need to change what they're doing through there, or whether we keep using what they've got. And then also importantly, and just as important, or more importantly, I guess, is their non-training stresses. So, what's going on in terms of their life. Again, one of the questions I'll ask on our intake forms is, how many hours of sleep do you get a night? Just your stress level on a 0 to 10 scale, and your diet on a 0 to 10 scale as well. Now, obviously, they're not research-based outcomes measures there, but they just sort of give me an idea of, opening the conversation. If someone's saying they're a 10 out of 10 stress, well, that opens the door to sort of say, well, look, tell me about what's going on at the moment, and because that can form we know that the importance that sleep and stress play in pain, and also in running injuries as well too. And the other question I should say that we put on there is how many hours of sleep you get a night as well. So I'm often quite mortified with some of the ticks that someone's saying I've got 4 to 5 hours of sleep a night. Then that again opens the conversation of something that you need to discuss there. And so I guess that sort of forms a bit of a holistic assessment. We've obviously got our condition specific discussion that we're having, but then also just getting a greater snapshot of the person or the whole of some of these stresses that might be occurring that are maybe contributing to their problem.
There's so much in here that's really about the person and what they're telling you, and of course it's an interview, but so their goals, for example, and then their specific goals. So rather than saying, well, I've got a template for how I help a runner, you've got a person in front of you who runs, and that's important to them. And you talked about their race that's coming up, and the time they want to do, and why they want to do it, and their expectations, and what they want to get out of it. So really a patient-centered approach, and then. And then, I really like that summary, your approach to measuring load. I asked earlier about, can you help a runner if you aren't a runner yourself? And the answer was yes. And you gave lots of reasons for that in part one. But at the same time, you've got you've got a Masters of Sports Science. You've got a healthy personal interest in running as well. What sort of role does planning ahead play with it? So you obviously don't. Someone doesn't come in as a runner and you come up with this plan for measuring and asking all these questions off the cuff.
Yep.
So, so you've done a lot of reflection on what it is you want to ask and why you want to ask it. And that's probably evolved over time as well.
Absolutely. Yeah.
There's a question in there somewhere, Luke. I'm summarising what you've told me, and I really enjoyed your summary of how you actually approach measuring load rather than, as you said, just giving lip service to it.
Yeah, yep.
You actually got a systematic approach to measuring it.
That's right. And I think, look, it comes down to really when we're thinking, and you spoke about, got a procedure for knee pain or this, that, and we just roll that out. Every injury, every injury is unique, because it's every person is unique, and so therefore, one person here with patellofemoral pain is not going to be the exact same thing here. If we do we put a lot of time into our history and our examination, we're going to identify factors that are very unique to that individual here versus this one over here. I mean, this individual here maybe, they're working night shift, they've got 2 kids, they're sleeping 4 to 5 hours, they've got a crappy diet, their training load's okay. And then this person over here, 10 hours of sleep a night, next to nothing stress, they don't have any partners, no kids, anything like that, but their training loads are all over the place. Now, obviously, we're going to be managing both of these very separately because we've identified here and here those contributing factors. And I think that's one of the problems with one of the challenges with research of looking at these things is that, this all gets washed out. If we can't clump people together and say, what is the common risk factor amongst through here, unless it's a very strong risk factor. And really the only thing that, looking at the running research, the only thing that's coming through is previous injury. That's the only thing that's really consistently showing up as a predisposing factor for injury. the rest, it's just a dog's breakfast in terms of everything else. One study will show that it's, these biomechanical factors. Another one here will show it's this. And so it's very hard to, and, I just did a recent, review through all the systematic reviews, and you just laugh because each systematic review is again different from, the different conclusions of looking at the same papers. So I think that, we certainly need to be implementing the research into what we're doing, but we always need to be looking at the individual that's in front of us and assessing them as an individual, and therefore, identifying targets for our management that they need to work on. And that's what I think. The challenge with research is to prove that is the best approach, or do we just give everyone the same thing, and does that work? So, and I don't think we've got the questions for that at the moment, unfortunately.
But we have hit on the foundations of helping people with running-related injuries, and that is to consider the person and all their variation, and consider that people, there's variation between people as well, and everyone's different. And so you've mentioned health, personal factors, and the goals, and they sort of form that foundation of understanding the person, and then applying research evidence as you can to that person, rather than trying to say, well, this is the evidence, and apply that to the person. It's backwards. What about And look, and a good example of that could be applying results of studies of strength and conditioning to everybody. What role does strength and conditioning play in your management of running injuries? I can see in the background, if you're watching this on YouTube, there's a squat rack in the background.
That's right.
Position that looks really good, and so there's a role there. But how do you fit it in with everything else?
Well, again, we've typical run through with a runner, as you can see, there's a treadmill there as well too. So part of what we'll do is, and I'm lucky that we've got access to technology like the force plates you can see there. So we are assessing strength. I do look at their running technique, and again, seeing, I guess the favourite saying is we're assessing, not guessing. So, does someone have adequate strength? And if not, then where are they deficient, and where do we need to work there? So obviously, if we're assessing a runner and that we have identified some strength deficiencies there, well then, strength and conditioning is going to be forming a part of their rehab. In terms of strength and conditioning from a performance benefit, yes, that can be effective as well for runners. But again, it's going to come down to what their goals are, what their time constraints are like. It's always a discussion, runners have. It's like, well, should I do an extra run or should I do a strength and conditioning session? And it's like, well, it depends on where you're at. Like, ultimately nothing gets you better at running than running. And so that's what you've always got to consider, that when you're introducing resistance training with runners, is that, well, is it really going to make them better? Are you going to help with their injuries there, or are you going to take away from that running? And a lot of runners, the reason they run is because they don't like the gym. And so you sort of, and I could probably put my hand up through there. And I don't say I love strength and conditioning. I've done times in the past where I've been done that quite a bit before, with some running interspaced in there. But now I'm getting more into running. Strength and conditioning is not the side of things that I enjoy doing it, but I do it. But I can't say that I enjoy it. So yes, it does form a part of my management, and the vast majority of my patients will get some sort of rehab because they're usually coming in with some sort of issue, and if we have identified a strength issue there. Again, you've got to assess that. You've got to assess and not guess.
Again, it's coming back to the person and their preferences and what they ultimately want to do. So you've acknowledged the importance of strength and conditioning if strength is a factor or conditioning is a factor, and you talked about perhaps considering strength and conditioning rather than a blanket for everybody, consider it from a rehab perspective for a specific injury or for performance. So and it's a good way of thinking about that question. Well, let's talk about osteoarthritis, which is a really common, burdensome condition, and it's going to be a really common question that we get when someone has a diagnosis, perhaps in middle age or on, about, it's a hip or knee osteoarthritis. Can I run? So, there's some good supporting evidence, unlike some other topics that we've talked about, where we can refer people to good information about to answer that question, to learn more about it from the literature and from lots of published resources. But we're talking to you, so we'll get your perspectives on it and how you discuss it with people. So, what are your thoughts on how how to manage running when you
Yeah.
have hip or knee osteoarthritis, or even to prevent it?
Yeah, so I think that there's been a lot of studies, and I guess in our circles, and some of our listeners would be well aware within our I guess our community that running can be good for knees, and that it doesn't lead to osteoarthritis. But unfortunately, there are still a number of health professionals out there and runners or just general people that think that it's bad. It's bad for knees and it does wear the joints out. I think some of the misconceptions there is the mechanical way of thinking, and that we think that the body's a car, and that the more you drive it, the more it's going to wear down. I still hear people, I had this discussion with a runner the other day, and they still prescribe to that, but that you educate them that the amazingly adaptive ability of the body, that we stress something, it gets stronger. We put stress on cartilage, and cartilage adapts and gets stronger through there. So it's sort of shifting them away from this idea of, oh, well, every time I bend my knee, it's just going to wear further down, and then I'm going to be, going to be bone on bone. And I think the other thing too with that is drawing them away from imaging, and it's always a disaster when the patient's being shown an X-ray or something, and then the health professional has pointed out and said, oh, look, see, that's bone on bone. That needs surgery, but they've got very little symptoms, and so it's sort of trying to draw them away from the imaging, which can be very hard because it's a very strong nocivic effect of, you can see right there in the picture, but it's always bringing it back to, well, how does it feel? Like, how does it feel to run? Oh, it doesn't hurt to run. I feel better for it. All right, well there we go. Well, that's what we're going to do through there, and sort of trying to bring it more back to function than away from the imaging. And we've seen some research, obviously, Horger's group that recently did some work on hip OA, and looking at they've done a couple of studies of looking at the immediate effects of joint damage, if you like, after a particular group run a marathon, and then comparing the images between non-runners and runners, and found that there isn't anything to show that running does accelerate that wear and tear. The only exception there with previous research showing is that the elite runners that are running a lot, there is a slightly higher rate of osteoarthritis in there. So I think we could sort of say that some running is good, but a lot is probably not so good. And this is, we're talking runners that be averaging well over 100 Ks a week, and probably,
a lot faster than you would. Well, maybe you're fast with your 3-hour marathon, but a lot faster than recreational runners go as well. There's forces to consider. Yeah,
that's exactly right. And then probably doing things that they shouldn't be when they're trying to run. Popping anti-inflammatories every day just to be able to do their sport. So, and I think that's obviously, as too, being involved in elite sport, these people might be very fit but not necessarily healthy. And so we can say from that research is that running is fine. And I can see where this myth has stemmed from is the fact that knee pain in running is the most common injury. Patellofemoral pain making up to up close to 50% of all running injuries being knee pain and patellofemoral pain. And so I think that is inferred that, oh, well, if there's knee pain, then that's going to lead to osteoarthritis down the track. Now, we know that patellofemoral pain doesn't necessarily lead to patellofemoral arthritis. It can be a very persistent and troublesome problem in some people, though, patellofemoral pain, but it doesn't necessarily mean to lead to bone on bone and needing a knee replacement. So I can see probably where this sort of stemmed from, but the research these days is not backing up the fact that you're going to accelerate your wear and tear, and you're going to head for a joint replacement.
It's this pervasive myth that just requires, a community effort from all of us to to continue to educate people. I think and also you touched on unnecessary imaging as well, and the nocivic effect that it can have. And of course, imaging has its role. If it's needed, it's needed. You're talking about unnecessary imaging, and just asking I really liked how you ask a question. We'll put it back on the person. Well, how does it feel? And that's a part of education. It's a question, but it's education. Okay, well, it actually feels okay. All right, well, I can explain that. The running at moderate levels, recreational levels, is healthy for the cartilage for this reason, rather than just coming on hard with the science and expecting the person to go, therefore, that's why it feels okay. Can be a little bit backwards how we provide our education. I like that, starting with a question.
Yep. And that's what I think also, it comes down to that communication as well, as not necessarily lecturing the person, the client, the runner, is you're trying to have that conversation. And I've been guilty of it in the past, of just an information dump on the patient, but it's just like, I've just, said too much. And I always sort of follow up, especially on that initial consult, always follow up with an email afterwards, just reiterating everything that we go through, because we know that for everything that we hear, we only retain a certain percentage of it. So I always sort of have this in writing, so sort of say, yep, remember what we discussed here, we're not doing harm with this, and this is the way that we're going to go through this plan. So they've got that down in writing, and so they can, reiterate that. They can send it on to, whoever else they need to as well. But yeah, mainly for their understanding of it, that they make sure that they retain all that
All right. We just had a temporary loss of communication there with a Zoom dropout. We're recording via Zoom. So, Luke, you were talking about, the importance of, in the education, how does it feel, and, providing that education that people need of where they're at that point in time. And then you were talking about the importance of also, you only remember a certain amount of what you hear, and then you always write things down and give people a bit of a summary.
Yep. Yeah, that's right. And just as you said, it's just that ability to retain stuff, and try and avoid doing a bit of an information dump. And I still even to this day, I look back and think, probably said a little bit too much there. Sometimes just keeping it simple can be good, but I guess you get a bit over enthusiastic sometimes. It's just like, I just want to just educate this person, just want to help them as much as I can and giving them this. But sometimes the drip feeding effect and just reiterating it each time to them, just repeating the same thing over and over again, so that they understand the message.
It'll be different for every person as well, depending on their needs. So one of the things you mentioned before, we were talking about the goal setting, understanding the person, and the whole body approach to, and the whole person approach to analysing their load and the other contributing factors to injury. You talked about sleep and diet as well. So let's just finish off with looking at the whole person.
Yeah.
If we are people running, we're not patients who are coming in with mechanical injuries like a car with a flat tire. We're people who have interests, and we're all different. So what's a bit of a summary of the whole person? How does general health, tissue health, the presence of disease, people's blood sugar control, medication, anything you can think of, what do you consider when you're thinking about the whole person?
All those things you just said, and that's where I really try and, in this initial consultation, that first time that I'm seeing the client, is just trying to capture as much information as we can in that time. So that's where I've got quite a detailed intake form where we're firstly they're spending a bit of time. They're probably spending 10 minutes filling that out with all those sort of details and medication history and previous surgeries and that sort of thing. But then spending that time talking with them for that 15 minutes, and then really sort of then delving into the different, possible contributors there in terms of their strength, their mobility, looking at, what their shoe wear, looking at analysing their running technique, all these sort of things are really going on to get a really good snapshot of that person as a whole. And then identifying things in there and obviously priorities, because if you've identified multiple things and you've got to figure out where to start, but identifying those priorities and then going after those first and gradually working through those. And I think that really should be the approach for not just the runner, but just for everyone, is, have that detailed conversation, have a detailed examination, and then formulate the plan for that person that's in front of you.
And we haven't talked manual therapy or hands-on treatment at all. And I'm not against or for it in any way. It's just very neutral here. But it's just interesting if you think about perhaps 20, 30 years ago, what was the foundation of, a private practitioner? We've been heavier with manual techniques. So you've covered everything from goal setting and understanding the person, coaching, and, screening for general health, and really considering their load and applying that to the person.
Yep.
Do you do any manual therapy techniques?
I do.
As well?
Yeah.
Since I brought it up.
Absolutely. That's part of can be part of the treatment as well too. And it's something that I certainly, when I first graduated, was a lot more manual therapy heavy practice. And I guess, again, looking back 20 years, that was sort of what was done at the time, but found myself, changing over time there. But absolutely, I will. I think there's certainly a place for it. And in terms of the expectation, again, you're asking this question. A lot of people sort of say, "Oh, I expect to, have some work done on this particular area." And so, if you're not meeting that expectation or explaining why you're not doing that, again, you can lose that patient. They'll just go off and they say, "Well, he wasn't listening to me at all. I'm going to go off and do this." So, yes, that will form a part of what I do, and I think there's some benefits of it. I think that it's certainly been bad-mouthed a lot, and something that I guess I'm seeing in the new grads these days. It's almost bashed out of them that it's evil to do that. But the tough reality is that the patients are going to be coming to them with some sort of expectation of having manual therapy, and you can educate them on the importance of exercise. But why not also, meet them halfway as well? If you're like, okay, we're going to do a bit of work around through here, but it's really important that we follow it up with this, and this is why we're doing this. What we're doing here, we've identified these strength deficits through here. What I'm doing with my hands here is not going to improve your strength. That needs to come from, the exercises that we're going to give you. So again, it's sort of that meeting them halfway and explaining what you're doing, but it doesn't mean that like, I don't do manual therapy, I'm not going to do it. And then all of a sudden the patient's offside. And it's like, well, I think that's what's going to help me. So see you later. I'm going off to find someone else. So that's sort of, I guess, the different approaches. And probably I think nowadays I'm a lot more flexible with what I do. And whereas previously before, being heavily manual therapy focused that's what patients got. And if they, that's what I did and that's what they got. And so over time, I've certainly learned to be more flexible with that and adapting to the patient.
And you really, what I've got from your conversation has been person-centered care and actually thinking about what that person needs, and then perhaps backing that up with measurements. That might be a good idea, assessing things, but also thinking about that person's own perspectives and what they're going to do and what their preferences are, which is what you're talking about there. So that gives, I would have thought that if you're listening to this as a student or a new grad or an experienced practitioner, that's going to give you a really nice insight into someone who really specifically works with runners and looks through that lens at people. But also you could apply a lot of what Luke's saying here to your practice in any area, any field, because the principles, the foundations of what we're talking about here are the same. You start with the person, and all people are different, and then base it around their goals and their needs and what that person in front of you is saying. That's what I've taken away from these two really interesting episodes. I reckon we'll leave it there. If you're happy to talk to me again, Luke, I'm going to pester you for another podcast, because I think I'm sure the listeners are going to really enjoy, getting your perspectives, and you've got lots of wisdom to pass across to other people, but also, you've got a really nice approach to explaining concepts, and it made a lot of sense to me, and I hope it made a lot of sense to the listeners. So we'll leave it there. But,
anytime, Luke. Yeah, thank you. Thank you for having me on, and any excuse to talk about running, I'm more than happy to be involved.
Absolutely. Now you're heading out tonight. Where's the run today?
Oh, I've already done my run. Actually, I got it in. I had a very narrow window in my day, so busy day in practice, and this on now. So I've got my run done. So that's good. So we don't have to. The rest of the afternoon is just work.
Oh, good on you. You're one ahead of me. I've got to go out in the evening and get a run in. But yeah.
Well, enjoy your run today, mate.
Thanks very much, Luke. See ya.
See ya.